Okay, so good morning, everyone. My name is Milena Lanz, and I am the Executive Director for Maternal and Child Health Consortium. Um, I just want to also express our gratitude. Thank you, Kevin, Kelly, Asa, um, Alicia as well for having us here. This is a great opportunity. And so I will provide an overview of our services, but then I will also share our challenges, what we're doing here, particularly in Coatesville, and some of our program outcomes as well. So Maternal and Child Health Consortium, we've been around since 1991. And the organization was created with the purpose of ensuring that women and children have access to healthcare. And so our main purpose, our vision is to ensure that families start healthy, stay healthy, and succeed in school. And that actually reflects our three core programs. We try to start from pregnancy, and that's the Start Healthy. And the Stay Healthy, basically healthcare access, so that we continue supporting families with our family benefits program. For many years, they have to come back and renew. And then Succeed in the School, we do have our family center program, just to ensure that parents receive all the support they need so that their children can be successful once they start school. Our mission is to support prenatal and parenting families in achieving healthy beginnings and a bright future through compassionate family center services. We provide services countywide. Our main office is in Westchester, but we also provide direct services from there. We do have an office here in Coatesville, and we also have a family center in Landenberg, serving South and Chester County. We do have county-wide goals, but also we have particularly specific outcomes and goals by areas. We know that each of the areas within Chester County have different needs, even though we provide the same type of services. Sometimes the approach is a little bit different. And I will refer mainly what we're doing here in Coatesville. So we do have bilingual, bicultural, what we call community health workers, parent educators, conducting home visits. And so we provide a lot of outreach, education, group connections, and also try to enroll, as I mentioned, moms during the first trimester of pregnancy. So our family center program and the Seed and Scale grant actually has been providing a great support for MCAC because about 2 years ago, with our strategic plan, we discovered that we really needed to provide some enhancements to our programs. And so we has been providing, as I mentioned, community health workers doing home visits with our Healthy Start model, basically ensuring that moms have been receiving prenatal care since first trimester, second trimester of pregnancy, working with medical providers just to ensure that they have access to healthcare. And then we were working with moms and the child and the whole family until the baby was 18 months. And then we discovered that we really wanted to go do more than that and serve parents that have children from 0 to 5. As in Southern Chester County, we, with our family center program, we have been providing services to parents that have children from 0 to 5, as well as actually running an annual kindergarten program with the school district, with the Kennett Consolidated School District. And that model has been super successful to us. And we really said we need to bring these services countywide. So here, particularly in Coatesville, we now are serving families that have children all the way to 5-year-old. We collaborate with CYWA. Of course, we don't overlap with zip codes. This is something that we, ahead of time, prepare with Parents as Teachers. Parents as Teachers is the evidence-based model that we use to conduct what we call the structured visits. So during pregnancy, our parent educators, they cover specific education information so that moms, it could be first-time moms, it could be a mom that might not speak the language, they might not really know how the health system works, and or of course emotional support. So we do screen moms on symptoms of depression during pregnancy. We use the editable postpartum depression screening tool, and we also help the mom to identify if they're actually going through severe depression, or maybe it's just temporarily, depending of the health assessment, right, and the score. We also screen moms on ACEs, adverse childhood experiences, and we educate moms and say, you know, has a relation be with parenting skills later on, and of course developing chronic diseases later in life. And so this is a great support. And once the baby is born, then we also work with the mom if the father is around. Lots of education and intervention working with father. As you can see here, we have a fatherhood initiative, and so we try to involve fathers just to ensure again um, that they are involved and they can actually they're involved in the life of their children, right? So we work with the mom, the baby, but also other siblings and anyone within the family. Part of this grant as well, so we implemented a doula model. We actually started doing a lot of research um, with another initiative that I will mention later, but we discovered that a doula model in Chester County, and here particularly in Coatesville, it's a big need. Since we've been also putting a lot of efforts and working hard to respond to the need after the closing of the hospitals, and seeing, our moms and families struggling just to, again, including transportation, but what else do they need to ensure that they have access to healthcare? So a doula model, it's something that we started over a year ago. And now parents as teachers as well, they are implementing a doula model um, just to enhance the type of services that we're doing. So where we are right now is that we are even recruiting community members and students. We're partnering with Westchester University to be able to um, support the certification of doulas that can actually support other moms within our communities. Um, and then we're also looking forward. We have the vision to hopefully collaborate with the school district so that we can also run kindergarten transition programs during the summer, which is a 2-week program. We have as well the family benefits program. We have family benefits specialists. They all day long they complete health insurance applications and SNAP benefits. We have seen an increase in demand. Just the first 6 months of last year, we overpassed the annual goal, and I'll share some of our numbers here in Coatesville specifically. And so this is a program that we work in collaboration with caseworkers from the Chester County Assistance Office, just to ensure that the application go through and it is approved. So we don't only complete the health insurance applications and the SNAP applications, but we also ensure that they get approved and communicate the family in case if they need to provide more verifications. Also with family benefits, we have family navigator services, and basically it's any individual who might need anything, any type of need. It could be enrolling their child in school, it could be health insurance, finding a medical provider, housing, anything, LIHIP, any need they might have, so that we connect them with the different resources. And also referring them between areas around the county as well. We have other child advocacy initiative. We have life skills program, diversion, family group decision making, and these are partnerships agreements that we have with children, youth, and families. This is also a home visiting program. So life skills is basically families that have children from 0 to 19. Some of the families that we serve are parents with teens. And so if they have a specific case involved in court, then we have our parent educators or parent mentors really that provide a lot of direction for parents as well as for children. Diversion is the same, but it's mainly prevention, right? So we provide group and facilitate group sessions as well, just that we can support decision making for young children. And family group decision making as well is basically we have a coordinator, and she facilitates meetings to ensure that the families and particularly parents, they actually develop a plan just to ensure the well-being of the child. If there is anything happening, of course, that it could be child abuse or neglect. Plans of safe care, we have, this is for pregnant moms, and if mom have been exposed to any substance use, we provide and ensure that once mom deliver her baby and then she's discharged from the hospital, that we work with the hospitals as well as the behavioral health organizations just to ensure that there is treatment for her and her baby and family members as well. And then we have, as I mentioned in the beginning, which is part of what we have been, this grant in Cosby particularly has been providing support, is the what we call SPIRIT, Strategic Partnership Initiative to Reduce Infant Mortality in Chester County. But it's coming from the perinatal periods of risk, PPOR. We started the study back in 2020. We were able to um, have a group of different stakeholders, including providers, small businesses, nonprofit organizations, community members, coming together and developing a plan and basically to develop some goals to ensure that we reduce infant mortality rate. And so one of the findings as well was to develop a doula model in Chester County. And so to share with you here, particularly in Coatesville, some of our goals. So we have a goal of with home visiting services, starting from pregnancy, as I mentioned. We had a goal of serving 40 we call them participants, and we were able to serve 48 participants, home visiting case management services, with a total of 168 members, including other siblings as well as fathers, of course, if they are involved. 100% of the babies born within the program, enrolled in the program, they have been having access to a pediatric care as well as health insurance. And we have conducted here in Coatesville 175 home visits and has responded to 113 phone calls, making it a total of 288. 98% of the moms enrolled in the program has completed, as I mentioned, an EPDS. So just having the health assessment, ensuring that if they're having symptoms of depression, we provide that support and ensure that they have access to behavioral health services. We conduct milestone screenings. We use the ages and stages screening, and 100% of the babies enrolled in the program has been screened with that. And then for health insurance, our goal was to serve at least 500 individuals, and we have overpassed the goal with 505. 75% has been approved, which our goal is to ensure that 85% of applications are approved. So we are still there. 16% are pending. Our goal here for SNAP benefits is 445, and 450, and we have completed 545 applications with 66% of approval. So we still have to work to get those outcomes, and we have 23% pending. And so one of our challenges right now is that we have been trying to, number one, develop more partnerships. So we're actually looking forward for the new health center that is coming. I already, to share with you, have met with Alisa, their CEO, to see how we can explore some partnerships and even maybe co-locate to provide health insurance, support, so that members can have access to healthcare, and of course to see, we see families in their homes, and so sometimes we don't know exactly what is happening, or maybe medical providers might not really have the time and patience to ask all the questions. So we can provide a lot of support just to ensure that if they are receiving any specific treatment, we can follow up with that at home and see what is happening, right? And if they need, for example, food, so that we can find more resources, or housing, they're going to be evicted. And I mean, we see many different situations where they can't focus on their own health because they have other priorities, right? What's going to happen to bring food to the table. So we are really looking to increase partnerships here in Coatesville, to work closer with other providers. And then also we are looking to increase and engage, increase enrollment and retention and engage our African American community. So with that, we're also hoping that implementing the doula model might be even a more efficient and holistic approach to support moms and just to ensure that they deliver healthy babies. we are always looking for volunteers. We work with different local schools. We provide not only the education and the intervention and facilitate groups, but also, of course, within kind donations, we provide support to families. And then, yes, connect with us. We are in social media, and we're always looking to work together. So thank you so much again for this opportunity. Questions?